In this video, I feel called to talk about hypertension in pregnancy. This is because I've seen quite a number of women come to the clinic with complaints of headache, and when we check their blood pressure, their vital signs, the blood pressure is actually high, indicating that they have hypertension in pregnancy. And that is why I'm making this video, so that we can look at what hypertension in pregnancy is, what can predispose a woman to hypertension in pregnancy, and possibly the possible management to give to a woman who has hypertension in pregnancy, or what to do to prevent hypertension in pregnancy. You're welcome to Body Gist. Do not forget to click on the subscribe button. I say thank you to all our returning subscribers. You can also do well to follow us on all our other platforms. We're on Twitter, Instagram, and Facebook. I am Sister Ozo Augusta, a sister of St. Lee. I am also a nurse and a midwife. Do not go away. We'll be right back. Welcome back. In this video, I will be explaining the difference between pregnancy-induced hypertension and hypertension in pregnancy. Now, hypertension in pregnancy means that a woman has hypertension in pregnancy, whether it is pregnancy-induced or not. So, a pregnancy-induced hypertension is one of the hypertensive disorders that occur as a result of hypertension. Now, what is hypertension? Hypertension is a persistent raise in blood pressure above 140 millimeter of mercury, 140 over 90 millimeter of mercury. 140 is called the systolic blood pressure, while 90 is the diastolic blood pressure. The systolic is the value above, and the diastolic is the value below, the denominator. So when a person has a raised blood pressure, a persistent increase in blood pressure after measuring it for 3 consecutive times, and realize that this blood pressure is persistently increasing, or it has remained above 140 over 90 millimeter of mercury, we can say that the individual has hypertension in pregnancy. Hypertension in pregnancy is used to describe the group of hypertensive disorders that occur while a woman is pregnant. Hypertension in pregnancy may have begun before the woman became pregnant, or may occur during the first 20 weeks of pregnancy. This is known as hypertension in pregnancy. And hypertension in pregnancy may or it may not lead to pregnancy-induced hypertension. Now, what are pregnancy-induced hypertension? Pregnancy-induced hypertension are the group of hypertensive disorders that occur after the 20th week of gestation. One of the examples is gestational hypertension, which occurs at 20th week, which may or may not have proteinuria as one of the signs and symptoms. While we have preeclampsia. Preeclampsia is hypertensive disorder that occurred after the 20th week of gestation and has proteinuria and pitting edema, that is edema of the feet, as one of the signs and symptoms. Hypertension in pregnancy are a group of hypertensive disorders that occurred while a woman is pregnant. Either the hypertension was there before she became pregnant and didn't go away, or the hypertension was there leading to other forms of hypertension, or the hypertension did not begin until after the 20th week of gestation. Now I will explain the first type. The first type is called chronic hypertension. It meant that the woman had hypertension before she became pregnant, and this hypertension did not go away while she was pregnant until the 20th week and after the 20th week. The second type of hypertension is known as chronic hypertension, which is superimposed, meaning that the woman was either pregnant, either having hypertension before she became pregnant, or she became hypertensive during the first 20 weeks of pregnancy. And this hypertension has led to some other complicated forms of hypertension, such as preeclampsia. This is known as hypertension, chronic hypertension that is superimposed. The third type of hypertension, that is a group of hypertension in pregnancy, is now what we call pregnancy-induced hypertension. This means that it was the pregnancy that induced the hypertension. This woman had hypertension after the 20th week of pregnancy. An example of such hypertension is what we call gestational hypertension. And another example is preeclampsia. Now let us look at pregnancy-induced hypertension. Remember, I said that pregnancy-induced hypertension occurs after the 20th week of gestation, and the first type of pregnancy-induced hypertension we have is gestational hypertension. This type of hypertension occurred after the 20th week of gestation, and there are no signs of protein in the urine, and it is not leading to any organ damage, but it may persist until the woman delivers, and it disappears immediately after the woman delivers. Gestational hypertension can also lead to preeclampsia in some rare cases, but mostly does not have protein in urine, which are the cardinal signs of preeclampsia, and there is no pitting edema, but the woman has a raised blood pressure, and this hypertension occurred after the 20th week of gestation. Once the woman delivers her baby, this hypertension disappears. This type of hypertension is known as gestational hypertension. Now, the next type of pregnancy-induced hypertension is preeclampsia. Preeclampsia occurs after the 20th week of gestation, and it has 3 cardinal signs. That is increased blood pressure, there is protein in the woman's urine, then there is edema of the leg, pitting edema. All these are characteristics of preeclampsia, and it is characterized with organ damage. Preeclampsia can lead to seizure, and which is known as eclampsia if the woman is not well managed. Why do we need to worry if a woman has hypertension in pregnancy or pregnancy-induced hypertension? This is because hypertension in pregnancy or pregnancy-induced hypertension can lead to a whole lot of disorganizations in the woman's system. First, it can lead to placenta insufficiency, meaning that the baby inside the womb won't get enough nutrient because the baby will not get enough blood, so the baby won't get enough oxygen and nutrient to take care of itself. Then this might lead to growth restriction or growth retardation. Increased blood pressure can also cause the woman to have a condition what we call placenta abruptio. This is the placenta detaching from the attachment of the uterus. Of course, when the placenta detaches, this places the baby at risk, and the woman and the baby might lose their life from bleeding if this is not taken care of. What are the risk factors? What places a woman at risk of coming down with hypertension during pregnancy? One, we have age. Women who are younger, that is a woman who has not gotten to the age 20 before she before she became pregnant, is at risk of having hypertension in pregnancy. Then a woman who is above 40 is also at risk of having pregnancy-induced hypertension. Then if a woman has had hypertension in her previous pregnancy, it is most likely she's going to have hypertension again in the next pregnancy. Then women who have multiple gestation, twins pregnancy or twin gestation, can come down with hypertension in pregnancy. The woman who have gestational diabetes or gestational hypertension can come down with pregnancy-induced hypertension. And pregnancy-induced hypertension or preeclampsia is more common in women who are first-time mothers can also come down with preeclampsia or come down with pregnancy-induced hypertension. All these factors can make a woman come down with pregnancy-induced hypertension, including lifestyle. If a woman is engaging in risky lifestyle such as smoking or taking alcohol during pregnancy, it can predispose her to having pregnancy-induced hypertension. So how do women prevent themselves from coming down with hypertension in pregnancy or pregnancy-induced hypertension? First thing I say to women is that plan your birth. And planning the birth, before you become pregnant, come to the clinic, come to the facility. Let us know if you are fit for this pregnancy. Of course, so many different tests will be made on the woman, will be carried out on the woman, including blood pressure check, and this will either confirm or exclude hypertension, and it will help us to know if this woman is fit to carry the pregnancy or not. The second thing a woman needs to do is constant blood pressure check. Then if a woman is pregnant, let her visit the clinic or come for antenatal clinic or come for antenatal booking as early as possible in the pregnancy to prevent her from having a raised blood pressure that she's not aware of. Of course, healthy diet would also help a woman to keep away from a raised blood pressure. Then a woman needs to keep at her exercise, small walking, simple exercise that she needs to do around the house. All this will help her heart to function normally and to keep the blood pressure from being raised. We have looked at what hypertension is, what hypertension in pregnancy is, and what pregnancy-induced hypertension is, because those two words are often being confused. Hypertension in pregnancy and pregnancy-induced hypertension. One occurs either before pregnancy or during the first 20 weeks of pregnancy, while another occurs after 20 weeks of pregnancy. And if it is pregnancy-induced hypertension occurring after 20 weeks of pregnancy, it can either have the woman can either have protein in her urine leading to preeclampsia, or she's just having hypertension, which we refer to as gestational hypertension. And we have looked at the predisposing or risk factors that can make a woman to come down with hypertension, which we say her age is there, which we say if she's a first-time mom. Of course, if she does not maintain a healthy habit or lifestyle, all this can predispose her to having hypertension. And we have also looked at the things she needs to do to maintain a healthy habit or a healthy lifestyle during pregnancy and prevent her from coming down with hypertension. If you have found this video beneficial, if this video is useful to you, do not forget to give us a thumbs up, like our video, share our video. This is me saying thank you to you for watching this video to the end. I remain your nurse midwife, Sister Ozo Augusta. Keep following us on Body Gist while we keep giving you healthy gist.